Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes with Valley Health. Post-traumatic stress disorder, PTSD, you've heard it before. It can affect anyone, absolutely anyone, regardless of their age, after they go through a traumatic event or even witness one. So what does all of this mean, and how do you deal with that? We're talking with psychiatric, mental health, family nurse practitioner Jordan Adkins about that today. It's so heavy of a topic.
It is.
And people think, PTSD might just be in regards to veterans, but this can really affect everybody.
It can, and a lot of people carry a lot of shame with it, and that's why they hide it, and it's a pretty taboo subject.
So let's make it not taboo. What are the common symptoms of PTSD that people may not even realize that's what they're going through?
The two most common, I think, are nightmares and flashbacks that people know of. So the flashbacks would be you kind of relive parts of the trauma as if you're right back there in it. They can be triggered by people, places, situations, smells, words, TV shows that you're watching, and people will go to great lengths to avoid these triggers, such as if they were in a car accident that was traumatic, they won't even ride in a car or drive a car.
Yeah, that can be life-altering if you're not going to ride in a car, and these things can really change the trajectory of your life if you don't deal with it. So let's talk about some of the examples of trauma that could maybe have that PTSD begin.
So any type of physical, verbal, sexual abuse, especially childhood abuse. There would also be neglect. Anything of trauma involving childbirth, especially loss of the child, war and conflict, witnessing domestic violence. If you were in like a severe car accident.
That's a long list of things that can trigger this kind of debilitating PTSD. So how do people deal with it? What's your first step in trying to get the help that you need?
Well, you can, of course, call the crisis line 988, which is also the suicide line, if you are in an emergency crisis. Of course, you can always call any mental health office if you need an appointment immediately. Of course, Valley Health is always taking appointments. The first step, if you want to be outpatient, would be you can do medication management and you can do therapy, or you can do either or. It's whatever you prefer to do. There are multiple types of therapy that you can do. Cognitive behavioral therapy and various types of that are available, and that's probably the most common treatment that you're going to get. So that takes the thoughts that are surrounding the trauma that are negative, reprocesses those, then attacks the negative emotions and calms those so that you can develop coping mechanisms to deal with the trauma.
Yeah, and it presents itself, PTSD presents itself in all kinds of different ways.
Yes.
Talk about some of those.
So with specific populations, you can have children who will present with odd symptoms that you don't expect. So they may start voiding or urinating in the bed after they've already learned to use the toilet. They may start acting out the trauma at playtime. They may start being extra clingy with adults. Teenagers may start acting out aggressively. You can also have people that have complex PTSD that actually suffered trauma for a long period of time, usually in childhood, and usually by someone they loved. And that just means that they suffered it for many, many years.
But there is so much help available. There are resources out there that can get you some relief.
Oh, absolutely. And I have to mention the veterans too, of course. Typically we'll see with veterans the combat type flashbacks, right, where backfiring of cars, fireworks, all of that will trigger flashbacks for them. So especially on the 4th of July, be respectful if you have a veteran near you. I've heard of many veterans having a lot of trouble on the 4th of July.
Right. Those sounds bring them right back
Yes.
to the trauma, to the first place.
Yeah.
It's encouraging, though, to know that there's help out there and that we just need to be aware that it can come in all different ages and from all types of different trauma,
Yes.
and get people the help that they need.
Yeah.
Jordan, thank you so much for being here.
Thank you.
Thanks for checking in on Monday Health Minutes.